Everyone. So this is Dr. Basavaraj, Associate Professor, Department of Biochemistry. So the allotted topic for me is actually confidentiality. So I'll brief regarding confidentiality, and one more half an hour session will be taken by Dr. Yogesh sir, and the concept of professionalism and understanding the concept of professionalism and ethics. So I think you all know. So this is actually outline of this session. So first I will brief introduction and definition and difference between confidentiality and privacy, how to maintain the confidentiality of our patient's information, when to disclose the medical information, case scenarios and brief discussion. So introduction actually, so this slide actually shows you the history of confidentiality. The Universal Declaration of Human Rights recognizes dignity, privacy, equality and inalienability of every human. It is on this concept of fundamental human right that the notion of patient's right is formed. This is generally referred to as rights of confidentiality. So definition, here it comes to these two are actually some interrelated words. So there is something known as privacy and second one is confidentiality. What is privacy? It is an individual right to control the access of his or identifiable health information. And confidentiality, it is a right of an individual to have personal identifiable medical information kept out of reach of others. So this is the keywords are control the access, that is a privacy, and confidentiality is you can just keep the medical records kept out of the reach of others. So these two are some interrelated words. So one more is actually proficiency secret. This is also some interrelated word. So what is medical secret? Any medical information that comes to knowledge of a doctor as a result of their work, whether directly or indirectly, obtained from the patient or otherwise. It includes any information about patient's identity, condition, diagnosis, investigation results, treatment, and or prognosis. So its disclosure will be undesirable or harmful to patient's health, reputation, financial, social as well as professional status. So these three are some interrelated words. One is the privacy and second one is confidentiality and third one is proficiency secret. So why is confidentiality very important in the medical healthcare system? So this will establish a trust between patients and health professionals. That's a key point actually. You can just see that diagram. So we have to build the confidentiality. So that confidentiality develops a trust between a doctor and patient, and later that can be utilized actually so that the patient will believe the doctor. So he can give information about their health with the confidence, whatever it may be, and that will be actually advantage for the patients, so encouraged to seek appropriate health care. So when they reveal the truths regarding their personal matters, so that we can treat them properly. So importance of maintaining confidentiality in healthcare. So what is the significance actually? Why we have to maintain the confidentiality? So patient will feel comfortable in sharing private information about their health related issues and medical history. So this is a key point actually. So what is the rule of medical this one confidentiality is so that the patient will feel comfortable to share their personal information. And second one, this information that they would not want widely known because certain health conditions are stigmatizing. Example, HIV, AIDS and mental health. So here it plays the confidentiality role is very important. And third one is the disclosure of these matters may be undesirable or harmful to patient's reputation, financial, social or professional status, or may cause difficulty in interpersonal relationships. So that's why these are some of these last 2 points of the drawbacks of breaching the confidentiality. Okay, the first one, why actually we should keep the confidential, because the patient will feel the comfortable. So because he believes a doctor, so he will not disclose our condition to anyone. So that's the reason actually we should keep a confidentiality between the patient as well as the doctor. And next is, if you breach the confidentiality, the consequences are second and third point. Okay, it will affect its reputation outside in the society, right? It also affects the financial condition, some interpersonal relationships. So what are the information included in the confidentiality? What are all things we should keep the confidential? The individual's past, present, physical or mental health condition. Okay, so this is very important in psychiatry. And any clinical information about an individual's diagnosis or treatment, a picture, photograph, video, audio tape or other images of the patient, who the patient doctor is and which clinic patient attends and when, anything else that may be used to identify patient directly or indirectly, the past, present or future payment for provision of health care to the individual. These are the different components of factors which can keep confidential. So how to maintain the confidentiality? So you can just limit the accessibility to the medical records. Do not discuss the patient medical information with unauthorized family members. Do not disclose patient information without his or her consent or in established exceptions. Set hospital policies that regulate access to medical information and how any breach to confidentiality is managed. Limit sharing of information with other staff unless in cases of consultations and second opinion. So Code of Ethics and Confidentiality. The rule of confidentiality in Code of Ethics. The Medical Council of India Code of Ethics regulations protects patient confidentiality by stating that the physician shall not disclose the secrets of a patient that have been learnt in the exercise of his or her profession, except in a court of law under orders of the presiding judge in circumstances where there is a serious and identifiable risk to a specific person and or community. For example, notifiable diseases. So exceptions to the duty of confidentiality. These are some of the exceptions where we can breach the confidentiality legally. So first is consent, and second one is court order, and third one is continued treatment, and fourth one is compliance, fifth one is communication. These are the 5 C's of exceptions to confidentiality. What are those 5 C's? So these are the actually can breach the confidentiality legally if the information are required by judiciary department for consultation of the second opinion and notification of events of public health interest or threats, for example, birth, death and notifiable diseases, prevent individual or personal threats if needed by the doctor to defend him or herself before court or judiciary or discipline committee. Remember, disclosure should be only to the concerned party, not beyond the needed limits. So rule of confidentiality in notifiable diseases. In order to provide guidance to protect third parties from the harm, we can disclose the patient health information in instances of infectious disease because withholding information can affect the health or cause serious harm to the third party. Within these guidelines, it is accepted that physician can and should inform third parties or the partner who may be affected as it can reduce overall harm. For example, notifiable diseases are just like HIV/AIDS, TB, COVID-19 and hepatitis B. So this is a recent scenario, the rule of COVID-19 regulations on patient confidentiality. The regulations state that actually any person who has been clinically or by laboratory confirmed as having COVID-19, who is suspected of having contracted it or who has been in contact with a person who is a carrier of COVID-19 cannot refuse a medical examination including taking body samples, and second one, admission to a health establishment or a quarantine or isolation site, and submission to mandatory prophylaxis treatment, isolation or quarantine or isolation to prevent the transmission. So you can just see one example, the infectious disease and the confidentiality. So with regard to infectious disease like HIV/AIDS in India, it is a treating physician obligation to inform the partner of a patient, though they need to inform the patient before disclosure. So before disclosing to the partner, so they have to take the consent from the patient. If the patient refuses to waive confidentiality with respect to their partner, the physician should inform the identifiable sexual partner. Okay. So this is a confidentiality where we are actually, so we are maintaining the confidentiality in case of infectious diseases. Genetic testing and confidentiality. It is also argued that in case of genetic testing, physicians can inform third parties who may be at risk because it can ameliorate the possible harm by providing choices on their lifestyle and reproductive plans. So we have to actually reveal the genetic disorders. Confidentiality in mental health care. Okay, this is a very important component. The patient-physician relationship is bound by the moral and ethical sanctity of confidentiality, more so in mental health. This is one of the fundamental responsibility of a psychiatrist. Few patients with a mental illness want their information and diagnosis to be disclosed to their caregivers to get the required family support. Hence, written informed consent from the patient with a mental illness, including permission as to how much can be disclosed, and this should be documented in the patient's notes. Such written authorization from the patient may protect the psychiatrist in the court of law. So that is the informed written consent should be mandatory to disclose the mental illness. So this is a PCPNDT Act, that's nothing but Preconception and Prenatal Diagnostic Technique Act. So this act is mainly meant for to prevent the female feticide. Okay, so we can, by this PCPNDT Act, we can just we cannot disclose the female gender. So that previously what happened actually, so disclosing of the female gender will lead to abortions, many abortions. To prevent that female feticide actually, so So the government protocols made the PCPNDT Act. Here in this actually the procedure that a mother has to follow in order to avail of prenatal diagnostic testing is mandatory, consent of age, abortion history and family history, and these conditions require a woman to reveal sensitive information concerning family history of mental retardation or physical deformities. A special concern for privacy and confidentiality should be exercised with regards to disclosure of genetic information. So, ethical guidelines for biomedical research on human participants. So, in case of research, confidentiality plays a very important role, because we have to include the human participants in the research. So, we have to take proper informed consent from the participants, and we have to document it, and with their consent we have to reveal the clinical history and laboratory findings to the authorized persons. Otherwise, that will breach the confidentiality. So, have you ever witnessed this? The first one is a patient being photographed without consent. This is actually illegal. A couple of doctors chatting about their patients over lunch. A doctor who is a relative of the patient having a look in his relative's medical record. A student approaching patients with the questionnaires without consent or institutional approval. Okay. So, these are the some illegal aspects which are routinely, if it happens, this is illegal, it cannot be followed. So, do not do that, respect your patient's privacy and confidentiality. So, who all should abide by the confidentiality clause? Who all should follow the confidentiality? Who are responsible? In addition to the treating doctor is the main pillar actually, who should maintain the confidentiality of the patient. Apart from that, administrators, public information officers, PROs, public relation officers, nursing staff, laboratory person, pharmacists and other paramedical staff like X-ray technicians, blood bank technicians, etc. All of the above are also ethically required not to disclose health information of a patient. Similarly, researchers must maintain, this is a research concept, researchers who will do the research must maintain the confidentiality of their patient health and other personal information, especially as the promise of the preserving confidentiality is essential part of the informed consent agreement. So, I will just give you the brief exercise, or else just I will go through the case scenarios. You can just see the case scenarios here. Patient Mr. X against hospital Judd. Okay, this is actually a case happened against hospital Judd and Mr. X patient. So, Supreme Court of India 1998 and 2002. So, this case was happened in 1998, it was run till 2002. The case was actually the patient Mr. X was engaged to be married. Thereafter, for some other illness in hospital, it was found that patient was HIV positive. So, he went for some routine screening, he found that HIV positive. This information was released by doctor to a patient's family, and through them the information reached the family of a girl who was engaged to the patient. This was all done without the consent of a patient. Okay. So, Mr. X was suffering from HIV and it was detected accidentally, and that information will be revealed to the patient relatives, and through that patient relatives, so that information went to a girl who want to marry that patient X. So, now the question is actually, is it a breach in confidentiality by the treating doctor? Okay. And second question is it a moral or ethical responsibility of a doctor to inform the patient family if there is a possibility of spread of communicable disease? So, based on the brief confidentiality information, can you just answer these two questions? Is it a breach in confidentiality by the treating doctor? Can anyone just answer me? Is it a breach in confidentiality by the treating doctor?
It is, sir.
Yes, sir. Yes. Yes, sir.
Whether that treating doctor should reveal it or should not reveal? Because that Mr. X was suffering from HIV, Mr. X was suffering from HIV and he diagnosed with HIV accidentally, and later actually that you can just see the scenario, the patient Mr. X was engaged to be married, but later it was broken down. Here actually whether the doctor did correctly, whether he breached the confidentiality by the treating doctor, whether it is right or wrong.
He should have revealed over the consent of the patient, sir.
With the consent of the patient, he should have revealed it.
Yes, sir.
Okay. And second one, is it a moral and ethical responsibility of a doctor to inform the patient's family if there is a possibility of spread of communicable disease?
Yes, sir. Yeah, that is. He has taken the consent.
If second answer is yes, then what about the first answer?
Yes. Yes.
Is it a breach?
So it is a responsibility, but again the consent of the patient is considered more important, I guess.
Okay, the what court says, you can see the court verdict. Right to privacy cannot be upheld when the measures are taken for prevention of health of the others, for prevention of crime, or for prevention of rights and freedoms of others. Hence, doctor did not breach the confidentiality when he disclosed the information to the family members, because that is an infectious disease. He should disclose, otherwise what happens, that girl will be infected with the HIV. So he prevented it. So that's why actually court verdict says, for the protection of health of the others, that's not a breach. That is the clause I just discussed in case of infectious, rule of confidentiality in case of infectious disease. So there we can breach the confidentiality, because we are protecting the society. We are protecting a second person who is not infected. So same exactly in COVID-19. So we have to disclose the COVID-19 patient status, okay. Otherwise what happens, that the other persons who are not infected will be infected with that person if you do not identify that person. So here ideally we should not disclose, that is the confidentiality. We should not disclose the HIV status, we should not disclose the COVID-19. But here we can breach the confidentiality legally. The reason is actually we can prevent the transmission of a disease. The same thing the doctor did here, and it is accepted by a court, okay. So for protection of health of others, right to privacy cannot be upheld when the measures are taken for protection of health of the others. So it is legal. You can breach the confidentiality provided these three: for the prevention of health of the others in case of infectious disease, for prevention of a crime, okay, for protection of the rights and freedom of others. For prevention of the crime, if there is any, if you found any psychopath, he will kill serially, okay, you can just disclose in front of a society so that they will take precautions. That is also not a actually, that you can legally you can breach the confidentiality there. And second one is, yes, it is a moral ethical responsibility of a doctor to inform the patient family if there is a possibility of spread of the communicable disease. Is it clear? Is it clear?
Yes.
So the case scenario is actually neurosurgeon Dr. A and his patient Judd. In Dr. A patient, there was a malignant brain tumor known to carry very high risk of mortality. Okay, that patient Judd is suffering from a malignant brain tumor. Dr. A knew that patient Judd's wife was pregnant. Okay, so patient Judd's wife was pregnant. But Dr. A did not inform the family members as per patient's request to not disclose his health condition to his family. So he did not reveal the fact the patient Judd is suffering from a malignant tumor. Subsequent death of patient Judd, the uninformed spouse and uninformed parents went to court citing negligence by the doctor. They approached the court and they sued a case as negligence by the doctor. So question is here, was the doctor correct in withholding patient's serious health condition from family members?
No, sir.
Okay, what court verdict is actually, can see the court verdict. Supreme Court verdict says, it is a duty of the treating neurosurgeon to convey this sad news to the patient and his family. Okay. Since the patient was of marriageable age, it is obvious that with such a tumor, the union would lead to incalculable harm to the prospective bride. The woman and her parents should have been provided details of the illness and prognosis by the patient and his family. An instruction to this effect from the doctor to his patient would have been correct and manageable. Hence, the doctor failed in his duty as a physician, friend, philosopher and guide to his patient, his family and to the pregnant wife also. Okay. So here actually he would have disclosed it. And the case scenario 3, patient information sought by insurance companies. Patient Judd versus insurance company in 1991 it happened. In this case, insurance company contested that patient had underwent wrongful termination of pregnancy after she availed maternity leave. Okay. So insurance company contested that, but insurance company opposed the patient had underwent wrongful termination of pregnancy. Insurance company demanded female patient to furnish personal details like menstrual cycle, conceptions, contraceptions, pregnancies at the time of doctor consultation. Question: was it ethical, moral in insurance companies' part to demand for personal reproductive health related details to the details of a patient? Can insurance companies take these personal details from the patient?
No, sir.
Okay, so what court actually says?
Yes.
The Supreme Court held that questions related to individual reproductive issues are personal details and should not be asked in the service application forms. Such a requirement was held to go against dignity and self-respect of a woman. Hence, it was unethical or immoral or in insurance companies' part to demand for personal reproductive health related details of a patient. Okay. Thank you. So now so I just briefed the confidentiality regarding confidentiality. Now Dr. Yogesh sir will take the understanding the concept of professionalism and ethics among healthcare professionals. Okay. Thank you very much.
Thank you, sir. Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Yes, can you hear me?
Yes, sir.
Yeah,
Yes.
great.
Yes, sir.
Yes, sir.
Yeah, I'm coming onto the stage, and let's continue with the discussion we had in the afternoon, if you don't mind. Do you remember what we were discussing?
Yes, sir.
Yeah, what was it?
Confidentiality.
No, in the afternoon, in the sense.
Unethical ethics and professionalism a doctor should have, sir.
So we were discussing something related to ethics and professionalism, right? Can you be specific? Anyone? Can anyone be specific about what I discussed with? I asked a question to Dr. Chandan sir. Remember?
Utilitarianism. Yes, sir. Was the
Selective ethics,
then another
moral principles.
why ethics are important?
I asked Dr. Chandan sir some question, if you remember.
Why should we follow moral?
Why and how we should be moral?
Yeah. Why bother being ethical, right? That was the question.
Why should we be moral or ethical?
Yeah. Why should we bother being ethical? Can anyone answer that? Try to answer it. Anyone?
Because the only quality we have that makes us apart from the animals is humanity. And if we don't stay true to ourselves, then it doesn't mean
Uh,
anything.
Many animals also are much better, ethically better than us. We are humans, but many animals are, if you compare them to a lot of people, are far better. Would you agree?
They are more disciplined.
I'm just trying to discuss explore these ideas, trying to understand, uh, you know, where these concepts of ethics and professionalism come from. What do you think?
Sir, it's what we learn when we grow as we grow. That is what we are taught, which is good, which is bad, in order to differentiate the morality.
So you seem to you're suggesting that it is like we learn that as we grow.
Yes, sir.
Uh, okay. Anybody else has any other ideas?
Sir,
to deliver better services, and in case of conflict to decide which one we should do. So there we have to go ethically like that.
Okay. Yeah, but where does it come from? How do you become ethical? You have some internal, compass like thing, right?
So when you differentiate between right and wrong, only then you can know what your ethics are.
Okay. Basically, you are saying,
Related to personal.
It comes from within, sir. As you said, when you gave us that example, when you gave us that situation whether to push a person or not, that time we had to decide one over the other. So it comes. It's not something we think about, but as situation comes, uh,
okay. So,
we will have to decide accordingly.
am I visible to you guys now?
Yes, sir.
Yeah.
Yes.
Yes, sir.
So, let's go beyond what we discussed in the morning. Like, let's say uh, you are now a practicing doctor and you have become a transplant surgeon, and there are like five patients waiting in your waiting room, and each one of them needs a different organ to survive any longer. If you don't do the surgery, if you don't transplant, uh, let's say for example, patient number 1 to 5, one needs heart to survive, two needs one lung, three needs another lung, four needs a liver, patient number 5 needs a pancreas, let's say, and a kidney. So these patients, each of them need a organ to survive, and you don't have a donor. You don't have five donors. So next to your consulting room, there is another, consulting room where a patient, a normal person, quite healthy, he came for cough and cold, and he is waiting there for the other doctor to come and see him. And you are sitting here and thinking, what can I do here in this situation? I need to save these five people. There is nobody else seeing, looking at you, and there is one healthy person whom you can actually hit on the head and probably kill him and take all his organs and transplant them to these five patients. And with these new organs, all those five patients are going to be like live healthy, normal lives for at least a foreseeable future, and they are quite successful in their business life, and they have loving and caring families for them, and they are providers of the family, and they're quite they also uh, employ a lot of people, and they provide employment to quite a lot of people. The other person was he's an orphan, and he is being, but he's otherwise healthy. He is a manual laborer. He works in the fields, and he is quite healthy. But there is no one if he goes missing. There is no one to cry for him. What should the doctor do? Anyone?
So we can't take away something that we can't give. So if I kill a person, if I take out his life, I can't give it back. So it's not ethical for us to do that, which is why this is wrong.
Anybody disagrees with her? What's your name? Can you tell me your name?
Janavi, Janavi, sir.
Janvi. Okay. Anybody disagrees with Janvi? You're going to save like five very successful business people who are providing for thousands of people by employing them, and there is one person who is not going to be missed by the world because there is no one for him, and with him, his sacrifice, you can actually save five, good individuals. Anybody disagrees
Doesn't
with?
matter.
You should have his consent as well.
If
You should have his consent as well.
patient agrees, then I mean the cold and fever patient agrees, then we can do it. But if
Why
not,
would he agree? It's his life after all. Why would he consent? I mean, why would anybody would want to be ready to give their lives for that? He just has cold anyway.
That's a wonderful, idea. Somebody said consent. Who was that?
Sir, Gaurav sir.
Yeah, Gaurav. What do you mean by this consent? And how does it make it morally permissible if there is an element of consent? Why is it important?
Like his life is his belonging, and if he's like if you go for organ donation, no one can force you into doing it. So, but if you are ready for it, then it shouldn't be a problem.
Okay.
Is what I think.
So, if you reflect on this idea of consent, so what does it actually mean? I mean, we are trying to tease out these principles of bioethics. See, there is, we are all embodied animals. We are no different from any other animal. We are essentially like we are also animals, and only difference may be like our prefrontal cortex is slightly uh, larger, not large enough because we see a lot of stupidity going around, but it is slightly larger compared to many primates, which gives us the ability to think critically and reason, use logic and reason, right? So, given that condition, the human condition, being a biological creature and taking part in the society, being a part of the society which has enabled you to be born and be a part of that society, comes with some, I mean, if you want to live in a society, you have to agree upon the entire society or community or the nation or even the entire planet has to come to a consensus about what goes in the society. So that is where the our need for ethical thinking or this moral philosophy comes in, so that you have to, like, because you are part of this society, your actions have consequences or your inactions have consequences. You need to be able to come up with a constructs for the society so that everybody has a productive and a productive life which maximizes well-being of all concerned individuals, stakeholders, right? Do you agree with that?
Yes, sir.
So it, we are bound by these societal norms or ethical principles. If imagine there is a universe which has no consciousness, every animal doesn't, has absolutely no consciousness, cannot feel pain, cannot suffer. There is no idea of suffering. There is no suffering at all. Then would your ethical principle apply even then? Does it matter if you do something in a completely oblivious universe?
No, sir.
There has to be some suffering for whatever you are doing to mean something to anyone,
Yes, yes, sir.
right? So there is a if you take that supposition, you assume that universe is not unconscious. Like there are animals or there are beings that are capable of suffering in this universe, then you are granting that you are, because that is a reality. I mean, I'm not giving you some abstract thought. That is the reality. Universe is like, we are part of the universe and you are capable of suffering. So if we are capable of suffering, everybody is also capable of suffering. So in that case, if somebody is capable of suffering, then what do? You have to think about what your actions will do, right?
Yes, sir.
So that is how moral and ethical principles mean something. That is why it is important for you to consider or think about these issues. And to add to that, as we are human beings, we have evolved over a long period of time, and this evolution has enabled or is responsible for developing our brain or our nervous system in such a way that now we are probably left with no option but be conscious about our actions and be ethical, because a vast majority of people do have an innate sense of right and wrong. Why does something feel right to you when you do something? Let's say you go and donate blood. You are an young adult now, and you decide to go and donate blood because you are not going to lose anything by donating blood, and it is going to cause a very minimal discomfort while the needle is being pricked into the vein so as to collect the blood, and that blood is going to save somebody's life, and you feel good about doing that. Why should you bother doing it? Because and why do you feel good about it? Because your brain is evolved to appreciate that selfless act. You don't get anything out of it. By donating blood, you're not getting anything. You're doing it out of complete altruistic instinct, which, if you see many animals, like including primates and elephants and some even birds like crows, they all exhibit this altruistic nature. We are not special in that we are the only ones capable of empathy and altruism and moral behavior. We are part of this, you know, animal kingdom where many animals who are equally evolved to us, they just don't have the same kind of evolution or evolutionary characteristics, or these are called phenotypes. They have different phenotypes, but they are equally evolved, and they show these characteristics very well. Only thing is we are not capable of understanding them. So this is where probably, I mean, these are the ideas that are still developing. Evolutionary biologists and psychologists, as I said, they're still debating about where these moral values come from and how we get here, uh, why we feel good about being good, doing good to others. But does it really matter that you are ethical, you are a good person? Forget about being an ethical doctor. As a human being, does it matter to you that you should be a good person at a personal level?
It does.
It does.
Yes, sir.
Yeah, it should. I mean, that's one of the things that we are endowed with, the capacity to reflect upon our actions, and we have hindsight. We understand the consequences of our actions, understand these principles, and those neural circuitry become much more stronger in us by repeating what we see and imitating what others do around us. You all said, like, so we probably have this. I mean, we follow our parents, and we see, we learn as we grow older. We learn all these characteristics as we grow older. Am I audible? Sorry, there was a network connection loss. Okay, am I audible now? Guys, students, am I audible? Students, am I audible to you? Can you hear me? Can someone confirm if I am audible? Sorry, there was a network issue. I'm just trying to wind up the things. If I'm audible, somebody can confirm, that will be great. Okay, as I was saying, so these ethical issues and principles, probably we are hardwired to think a certain way, but it is very significantly influenced by where you grow up and what is your circumstances and what you read and what you have been taught in the school and how you are encouraged to think critically. So my suggestion to you is, this is the right time to think critically and also you know uh, try to use your logic and reason so that the circuit